Hey Mavericks, what's up? It's me, Justin Hidalgo, back again with another edition of Mavs Chat, where we're going to be talking about this bad boy right here and why it's important for you to wear it. The topic of whether or not you should wear a mask in public has sparked lots of conversations across the country on just how impactful it is in stopping the spread of COVID-19. For many, including myself, wearing a mask can be uncomfortable and at times inconvenient. But listen to me when I say it's absolutely necessary in protecting one another from contracting the virus. Don't just take my word for it. Our very own Zaria Turner sat down with Dr. Middleton, the Director of Health Services, on why you should wear a mask.
Okay. Well, thank you so much for joining us on Mavs Chat. And if you can introduce yourself for our audience.
Hi, so I'm Angela Middleton. I am the Director of Student Health Services, and I am a family medicine physician.
Okay, Dr. Middleton. So my first question is, with the increasing cases in Texas of COVID-19, what can we do to stay safe?
Yeah, so all the stuff that we've been hearing is super important. So number one, if you can, stay home. You're going to be just around less people, and you're going to be less likely to be exposed. Obviously, we can't all stay home all the time, so when you do go out, you do want to wear a mask, especially if you're going to the grocery store or other places where there's a lot of people, and you may not always be able to stay more than 6 feet away from them. On that note, if you can, try to stay more than 6 feet away from people when you're out and about. Also, as we've all heard, frequent good hand washing is super important. And if you don't have access to a sink and soap, using hand sanitizer with more than 60% alcohol content can be a good substitute.
I guess my question after that would be, what is the importance of wearing a mask or a face covering?
The reason masks are so important is we know that COVID-19 is spread primarily through respiratory secretion. So when we cough or sneeze, or just when we talk, little droplets come out of our mouth and nose, and that can spread fairly easily to other people. So if you are wearing a mask, it's going to catch those droplets and make it a whole lot less likely to spread to somebody else. And what you'll frequently hear is people will say, but I don't feel sick, so why should I wear a mask? Well, what we know is, number one, there's a lot of people that never really get a lot of symptoms. So they may just have something really minor and not think of it as being COVID-19, so they're not thinking, oh, I need to wear a mask. Or they may never get symptoms, and if we were to test them, they would test positive. We also know you can have a period of time where you're infectious, but you haven't developed symptoms yet. So if somebody got symptoms today and I were to interview them to figure out who would be somebody they've exposed, I would go back 2 days before the day they developed symptoms. So you're considered infectious 2 days before you develop symptoms. But since you can't predict the future, you don't know what day you're going to develop symptoms. So you should just always assume you could be infectious and wear that mask.
My next question is, if someone is worried about COVID-19, what are some of the symptoms that one might experience if they are positive with COVID-19?
Yeah, that's another great question. A lot of the symptoms for COVID-19 are pretty similar to other viruses we see. So it can be sometimes hard to distinguish. So frequently people will have a cough. They may feel short of breath or kind of breathless, especially if they're up walking around or having a long conversation. They can have a fever or feel feverish. They can get chills. Sometimes they will get shaking chills and body aches. a sore throat, headache. Some people will have diarrhea or nausea or vomiting. And then frequently what I've been seeing in college age people, so young adults, is loss of taste and smell. The loss of taste and smell is pretty unique to COVID-19. We don't see that in a lot of other infections. So when I hear that somebody has that, I'm assuming they have COVID until I know otherwise.
And if someone does test positive for COVID-19, what are the next steps that they should take?
So once somebody has symptoms, they should isolate themselves. So stay home. If you live with other people, try to isolate away from them if possible. Again, if you're at home and you can't completely isolate from other people in your household, wear a mask when you're around other people. Again, good hand washing and all that stuff comes into play because you're going to be less likely to spread that infection that you have. You should try to figure out how to get a test. If you're a UTA student, you can call Health Services and we can work to get you a test done here. And then that should be really the only time you go out is to go get your test. And when you do go out, you're going to wear a mask. You don't want to just show up at a doctor's office without letting them know you're coming. So you definitely want to call ahead. And then you kind of go back home and just isolate and wait on your test results. If they are positive, you're going to keep doing the same thing until you're better. And right now, what the CDC has recommended is you will need to isolate for a minimum of 10 days. So 10 days from the day you develop symptoms, but you also have to have had 3 days of no fever without taking a fever-reducing medicines. That would be Tylenol or ibuprofen, aspirin, something like that, as well as 3 days of improving respiratory symptoms. So if you've had a cough, that cough should be better. Or if you were feeling kind of breathless, that breathlessness should be better for 3 days. And once you've met that criteria, then you're considered better. UTA is recommending people get a doctor's note before they return to campus to class or work once they've met that